Hey you guys, welcome to my channel, or welcome back to my channel. Thank you for subscribing. I hope I'm giving you some things to think about in this whole mess. Anyways, I've been down through so many rabbit holes the last week or two. I want to make, videos on something that's not everybody's doing the same thing. And so I have a couple of things here that I'm kind of doing this spurt of the moment because I don't want to have to go back through my YouTube and, find the videos again. I know how to save them now, but anyways. So let's just go ahead and get started. I'm going to start with this guy, and then we're going to play this lady doctor that I seen the other day. I'm going to play you a clip from both of them, and I'm going to watch them through again, and then I'm going to come back with some of my feelings about this. I seen over in the UK, I seen a lady, I don't know who it was, but they're filing a lawsuit. And boy, she did not hesitate. She let them have it. She said, any teacher, anybody that is pushing this in the schools, they are on notice because this group is going to put a stop to it. I'll look for that video and I'll put it on here too because you'll want to watch it. I think it's important because I really do believe we're in some kind of a psychological brainwashing experiment. I'm very worried. I feel like when these kids, I feel like the kids in school, or the ones that I've been seeing on the variety of channels, these angry, young people. And I can only imagine how the next 3 generations of high school graduates, how angry they're going to be. And I just see them being taught to not trust their parents and to hate their parents. And that's going to cause a lot of chaos coming up in the future. I don't know how this is going to be stopped, honestly. I really don't. They're in all the schools. They're training, the doctors, the people that you would think would stand up for this in society and say no more. The ones that are speaking out, I sure do appreciate them doing that. I can't believe that there's not more speaking out. Where are they? Where are the people that are smarter than the rest of us? I cannot believe I'm even having to make the videos. I'm like, when all of a sudden did I become the smart person in the room? And I know that they'll say that I'm not the smart person. That I'm a TERF. Well, whatever. I'm a TERF. So be it. I would rather be a TERF than somebody that's looking forward to their life having their genitals mutilated, because they are the ones in the future that are going to look back on the people that pushed this and say, what were you thinking? What on God's green earth were you thinking? How did you ever come to a decision as society that this is a good way to go? That's what I foresee. Maybe I'm psycho. I just don't see how it can turn out any other way. I honestly don't. I'm older, I've had kids. I've seen my kids grow up. And I can't even believe that I came out of the pandemic and this is what, life has become. I feel like in that movie, Blast from the Past, when they come up from the elevator, from the underground shelter, and they go outside on the sidewalk and, the world has just changed. Well, I feel like that's what's happened in real life, and I'm kind of living that. Well, in any case, we're going to get on to these videos. Now that I did all that chit-chatting, I'm not sure if I will have more commentary. We'll see. Let's watch the show. I got to rewind it. I got to turn it up. Yada, yada.
Folks who maybe have had minimal engagement with their own genitals,
here we
either
go.
due to dysphoria or just due...
Here we go.
Perhaps we could shift gears for a second and talk a little bit about the psychosocial implications. So, and I wrote this question specifically about younger trans and gender nonconforming patients, but as you said, expanding in either direction. So if you have insight about older patients who are coming in for surgeries, please do share with us. But you had mentioned previously about folks who maybe have had minimal engagement with their own genitals, either due to dysphoria or just due to the young age at which they're having surgery after pubertal suppression, or minimal to no sexual experiences prior, and how
young age they're having surgery. That makes me think adolescent before an adult.
And how
after vaginoplasty we're asking them to do all these high maintenance things and be really involved with this anatomy, and just the psychosocial implications of that.
It's something we've been talking a lot about in our team at OHSU, and we're kind of writing up our early experience with peds endocrinology and pelvic floor physio and us as surgeons, and kind of really collaborating to put out, this is our early experience with this group of patients, and this is what's working and what isn't, because there's just so little that's really been talked about or described. And as more and more vaginoplasties and gender surgeries being done, and as more suppressions coming through, it's coming right at us. So as a field, we all kind of need to be aware and start thinking about how we can optimize these outcomes. And it's challenging because there's this question of how does that factor into consent when you're consenting someone for pubertal suppression, and there likely is some effect on downstage genital surgery, but you don't know if an individual is going to desire genital surgery in the future or not. And then it's also hard to have a conversation with someone that maybe hasn't went through puberty or ever engaged in sexual activity. It's a really tricky thing.
Okay. Tricky to have that discussion with somebody that hasn't even gone through puberty. What are we talking, 10 years old? What are they even talking to him for? Why?
And when it comes time to actually do surgery, if an individual does go through suppression and ultimately is in their latter teenage years and wants a vaginoplasty.
Latter teenage years, so I don't know if he's talking about latter as 16 and up or 18 and up.
Not only are you facing the struggle of not having a lot of tissue to work with, but that tissue hasn't been under the influence of testosterone, which definitely affects some things. And then a lot of patients, just from psychosocial issues and the dysphoria that they're experiencing, or just blatant transphobia in society, may have not had the opportunity to have a sexual partner. And more often than not, there's been almost no genital engagement in terms of self-stimulation or masturbation. So then trying to assess things like erogenous outcomes after a surgery when someone's never had an erogenous experience in their life is incredibly difficult because they don't really have a baseline to compare it to. And then,
So these kids are not going to have a baseline to compare what their life generally should have been by Mother Nature's standards. I don't think any of the reasons that he is talking about it makes it a good idea.
Postoperative care, anyone knows that seeing a postoperative vaginoplasty patient is really intense, and we're kind of asking someone that is younger and hasn't really engaged or done much of their genitalia to all of a sudden do this really aggressive relaxation for dilation, and it's just a huge ask. So we're finding that to be a barrier, almost more so than, yes, the surgery is technically challenging and demanding, but I think we're developing pretty good strategies to deal with that. But what we really need is a robust support system, and I think there's really a huge role for therapy peri-operatively in terms of preoperative genital engagement, trying to have those conversations, preparedness, readiness, support for that postoperative protocol, because some of the early challenges are getting someone to successfully dilate that's never had to engage with their pelvic floor musculature and is maybe 17, 18 years old. It's hard.
It's hard.
Maybe 17, 18 years old. 17 is a minor. 17 is too young.
Absolutely. I was talking to a colleague the other
18
day
is too
about
young.
that. Because she had a patient who was an adolescent and underwent pubertal suppression and had vaginoplasty, and it just had me thinking, when we undergo pelvic floor training, and I'm not a pediatric pelvic floor specialist.
Oh, she's talking about her friend whose patient was an adolescent, had suppression and vaginoplasty as an adolescent.
it just had me thinking, when we undergo pelvic floor training, and I'm not a pediatric pelvic floor
by any means, but there's still this ongoing conversations regarding the ethics of doing an internal assessment on an adolescent who's never had any sexual activity or even self-stimulation, and do like their first experience with their anatomy being from this provider or from dilation, which the symptoms associated with that. So it's just, there's a lot of layers to consider.
No, there is.
Sacrifice of virgins.
Oh, there is, for sure. And I think we're all having very open conversations, and with patients and families too, trying to figure out what is the best thing. Because, long term, we want people not only to have relief with dysphoria, but have like a functional and satisfactory, great sex life too. And, we're trying to think like, what can we do ahead of time? Like, are things like encouraging genital engagement preoperatively, is that a bad thing or a good thing? I don't think we really know yet.
It's a perverted thing. Just like having them do that, virgins are going to masturbate.
Issue, and I'm not sure there's like one
leak
answer
that out.
for everybody.
Having
but I think definitely
virgins,
something that we're going to learn a lot more about in the next 5 to 10 years as we're doing.
And then this guy goes in and cuts all their privates
I
off.
think that applies for all of y'all doing the pelvic floor physio too. So I'm sure we'll be in close communication.
Yeah, it will be fascinating to see how that unfolds. I hope that we see more research rolling out regarding assessing the efficacy of different interventions. You mentioned, how intense post-op care is after vaginoplasty, and that kind of is a nice segue into my next question about how
none of them are a good idea, and this is not something that is a 5 to 10 year learning experiment good idea. Well, I agree, it is fascinating, but it's not good. It's actually horrific. I think it's horrific. I think it's heartbreaking. And I think it's going to be a real black mark on our period in history. That's what I think.
You mentioned, how intense post-op care is after vaginoplasty, and that kind of is a nice segue into my next question about how
becoming increasingly common for folks to opt for a vulvoplasty, I believe is how you refer to it, otherwise known as a minimal or no-depth vaginoplasty. What trends do you notice in terms of how this impacts the outcomes of your patients?
Yeah, so I think everyone, runs their practices a little bit differently, and I think it kind of comes down to, again, like what I was saying with the binary bias of things. But I see a lot of patients that come in from all walks of life, all different backgrounds, all different ages, with varying degrees of social supports. And, on the other end of the spectrum, we were just talking about adolescents, there's a lot of people that come in like their 60s or 70s with other health issues and conditions who don't have a partner.
Okay, well, he's done talking about the young ones, so I got that part done. Part 2, I'm going to play a video and do my commentary of a doctor that claims that nobody does them on adolescents. Who's following W path and who is not, and who do they think we are to believe anything that they're saying? A lot of the channels I watch are being demonetized. Mine's not monetized. I have 12 subscribers, so, and I don't want to say anything mean because I feel bad about the people that it's happening to, but these doctors, this doctor, what are they thinking? What do their parents say? What do their grandparents say? Aunts, uncles, how do they feel about this? I don't think I'd feel very comfortable and proud and want to brag and celebrate if any of my family was doing that to children, healthy children. This feels like the new ADD. I know that ADD is a thing, but I feel like it got overly, diagnosed. And, then of course the depression. And then, the bipolar. I don't know what all these things is going on with those things. But the big things that I see that have changed is SRS for children, and honestly, SRS for adults. Like it's, common, and they've always had it, and they're losing all these rights. But I don't remember them having all these rights. I don't remember men being in women's competitions and winning first prize and being celebrated. I never remember that till recently. I guess it has happened a few times in the past. Like I say, I'm not a TERF. I'm not a transphobe. I didn't have a problem with this stuff. I did not have a problem with this stuff until probably about April or May of this 2023. When I finally something snapped me out of it. There's a lot going on then. Okay, I'm going to stop this now, and then I'm going to make a video doing the other doctor that says that this doesn't happen. So, Gaslight 101, who do we believe? Who's telling us the truth? Well, neither one. Well, this guy more so, because it is happening. So at least he's telling the truth. But there was another video that he did a while back talking about this kind of stuff, and he deleted it. But here he is again, only 9 days ago. Today is July 20th, 21st, and he's on there yapping about how experimental it is and how much they still need to learn, and they're going to learn. Well, that's a huge payment for society. That's a huge payment from those children's lives, and those parents' lives, and those grandparents' lives.
Speaking of in this field, and we've kind of hinted at it, but I do want to attack it head on, there are a lot of people who are very concerned right now. A lot of won't we think about the children rhetoric.
Oh, yeah.
So many people are concerned right now about minors undergoing any type of gender-affirming care, stay away from our kids, let kids be kids, all of that. But most especially outraged at the idea that they might undergo permanent body modification before the age of consent. Only speaking from your perspective, only speaking as a medical doctor, from your perspective and understanding of the field, what does gender-affirming care look like for minors right now? When could they begin treatment, and what does that treatment look like?
So I will speak to this from a surgical perspective, since any hormonal therapy that is done before I would see any minor surgically. So these are done at multidisciplinary centers that I work near. So I want to address this head on. I agree with you. Surgeons are not operating on children. And I want to be clear that the social, legal, and political definition of a child is different than my medical definition, different than actually the medical community's definition. So the medical definition of a child is someone that ranges from birth to puberty. Now, just to be clear, so puberty can occur, it's a range, and it differs in boys and girls. And so puberty can occur in girls from between the ages of 8 to 13 and 9 to 14 in boys. Now again, these people are, quote, legally and socially still considered children. So I like to use the term minors to keep it a little bit clearer from that legal perspective. So I think when we're having discussions like this, socially, it's what definition are we talking about? Are we talking about the medical definition, or are we talking about the socio-legal, political definition? And so surgeons are not performing surgery on people that are, quote, quote, children by our medical definition, not before people that undergo puberty. Again, and what is...
If they're put on puberty suppressants, how do they know when they would have gone through puberty? It sounds to me like she just said, for girls, it's between 8 and 13. And for boys, it was between, I don't want to rewind it, but 9 to 14 or something. Anyways, I think that most people in the general public consider a child a minor in all aspects of life until they're 18 years old. That is how long a parent is legally responsible to provide for their child. And that's what the most of the rule everybody is going on. What kind of new rules are they trying to change with the medical? I don't know. I'm just asking. So here we go.
It's interesting, and I'm going to pull the field of bariatric surgery back into this. So the World Professional Association of Transgender Health came under fire because they kind of, quote unquote, removed the age requirements for surgery. I want to be clear that, like, and again, you know, children and minors, like I said, I should say, I'll stick to that term, this requires, like, significant multidisciplinary and parental support. Like, people that are getting surgery that are minors need parental consent, first of all.
No, that is not true. This was done 12 days ago, and in Oregon, a 15-year-old girl can get a mastectomy with no parental involvement at all. Look it up.
And they are seeing, like, child developmental specialists. They are seeing, like, this multidisciplinary team of people that determine, like, each individual's emotional, cognitive, and psychosocial development into account. There are ways to screen for maturity. There's ways to screen for whether people can understand and obtain that kind of informed consent. So you have social workers, mental health providers, parents, and, you know, you also talk about regret and fertility preservation in these conversations.
I do not know if you can preserve fertility on somebody that's never been through puberty. For a girl, you do not start, you have eggs in your ovary. I think you still have to have them come out your ovaries. I don't think they can just dig in your ovaries and get out your eggs. What I'm saying is, and I'm not positive about this, but my understanding is that when you go through puberty and you start having your period, that's because you're laying an egg every month and your body is preparing to have a baby like it has since the beginning of time for girls. If this was that much of a horror to go through, there would be dead people all over the place throughout history. We'd be going around saying, what's killing all these people? Why is so much of our population dying? You know, it would be a huge number from how I am understanding it from all the videos I'm watching. And I watch a lot of videos.
So this is stuff that's all done that's not talked about. And these are things that are handled and addressed long before they hit a surgeon's door for a surgical consultation. These are highly trained professionals that know how to assess that person's maturity before they would undergo this quote-unquote irreversible procedure. And so I keep bringing bariatric surgery into this because
from my understanding, all of these stunning and brave people that help the other stunning and brave people are all under the same guidelines, that if you say anything other than, oh yes, I believe you are the opposite sex, they can lose their license for being for doing conversion on them. Now, I'm going to link this guy's channel. It's called the Jester of EDI, the Court Jester of EDI. It's going to be down in my comments. And I'm putting whatever videos in the comments because I'm trying to refer to ones I've watched in the last few days. So you can get an idea of what time period of what's kind of going on from other videos as well, because there's so many different sides to this issue, so many different rabbit holes. And like I say, I'm trying to do something like this video I'm doing now only has 309 views. And the other one, I don't think it had very many views either. I can't remember. I'm trying to bring a new light into it from what I see in my observations.
Bariatric surgery, again, aside from the multidisciplinary model that
she was talking about how bariatric surgery is this and that and blah, blah, blah. And I know that Lisa Presley just died of that, which is very curious because I never remember her being fat. Anyways, that's what happened with her. So this lady is, talking about that, trying to say why this is kind of, what makes them any better than us or something like that.
Requires very similar to my model, of gender affirming surgery and care. There's no technical age limit for how low you can do bariatric surgery on someone. And like, that's a pretty big procedure, depending, I mean, that child's life and that minor's life has changed forever. You know, when it was first performed, life has changed forever.
Just like with the sex change. And obviously they shouldn't be doing that either. Look at what just happened to Lisa Marie Presley. Because nobody has any limits or any guidelines of to say, you're not that, you don't need this, you'll be all right.
I think in California in 2004 on a 13-year-old, I mean, it caused an uproar. Wow. And so there's no age limit, but you're taking maturity into that. You're taking other conditions into account. And so this idea that we're operating on minors, that we're doing irreversible procedures on minors is not a new idea. There are surgeries done on minors all across the board, that have been done on minors all across the board, that require these very intense discussions. And we all take surgery on minors very seriously, regardless of our specialty, because you need to be careful about that. So, I find it fascinating that it's gotten this. And I find it fascinating that
I honestly don't believe they're taking it as seriously as they need to. Time will tell. That's my own personal observation.
Such attention when it's not this new concept in the field of gender affirming surgery. And part of the reason why it's very infuriating, and I think this is what, you know, if the most important thing I think out of this podcast are these numbers, because this really puts this into perspective. So cosmetic surgery is being performed on minors, like across the country. I have data from the American Society of Plastic Surgeons. This is accessible to the public, so you all can, if you Google American Society of Plastic Surgeons, you can find this data. Now, in 2020, it takes time to compile it, so 2020 is our most recent data we have. Between the ages of 13 and 19, 88,000 minors underwent cosmetic surgery.
And these are things like nose jobs, breast augmentations, that kind of thing.
Now, people may say, well, we need to compare apples to apples, not apples to oranges, because that's lumping all cosmetic surgery into it. So, okay, people want that. Here you go. So breast augmentations aren't really done under the age of 18. So if you look at people ages to 18 to 19, about 3,200 cisgender minors underwent breast augmentation, and about 4,700 underwent breast reduction. Do you want to guess how many trans individuals underwent top surgery?
Less than 100.
You're close. It's about 256. It's between 200 and 300 over like each year. So 2019, 2020, 2021. Is that number probably a little bit higher? You're probably closer to 400.
I'm going to go on a limb and say it's probably a lot higher now. Because from what I'm seeing in all the statistics, it's jumped, 4,000% here. I don't know this exactly, but I think it will be higher. I don't know if there's any more current statistics because this is only 12 days ago. There again, we shall see. And I don't think they should be doing those other things to minors either. Unless it's causing them a serious medical issue. But not for just cosmetic reasons.
400 if you were to pull that data for 2022. But like 300 patients, if you round up 300 patients to 87,000 cosmetic cases. So if this argument is going to be about we shouldn't operate on minors, why are we singling out the transgender minors, those 300?
Because all of those other procedures does not destroy that child's opportunity for a normal life when they are elderly, regardless of if they have children or not. They're doing things to children that the children will never even have a sex life. The doctor earlier, I seen a report that they're studying the nerve endings of the female clit. And, he's all into that. And you got this lady here trying to gaslighting us into thinking that all of those are just as bad. I don't think those are good either. They should not be doing those either. But that is not going to cause the mental health problems. And I bet you that does not cause the same mental health problems for the parents and the grandparents and the siblings of the newly transgendered child that has decided that the old them is actually dead and nobody can use that name anymore. So I think we're comparing something completely different to maybe some poor unfortunate girl that ends up with really, really big breasts, and they're hurting her back, you know. I can understand that happening, but anyways, that's neither here nor there, because that's not right either. But I don't feel it's going to have the same impacts on society that this is.
Transgender minors, and not looking at those 87,000 patients. So I find that that is a thing that is very frustrating to me as a surgeon, is that, again, this idea of operating on a minor isn't new. We all take it very seriously. But these patients, these transgender patients, get mental health assessments. They're coming from these multidisciplinary centers. Those patients that are getting rhinoplasties or breast reductions, they're not having to go, I'm sure they can go through some psychotherapy if they need to, but they're not having to do all that legwork in the same way that the trans patients are. And so it's very interesting that we're very upset about this small number of patients.
I've worked in the juvenile.
Again, I say those are not life-altering in the way that this is life-altering.
Justice system. I still know and am friends with a number of social workers. The fact that social workers are involved and could at any time rubber stamp any of it at all tells you, social workers take their job very seriously. I have said for many years that there needs to be a TV show celebrating social work because
I agree with that.
It is.
I honestly believe that the social workers have been gaslit or controlled. They have to accept it if they want to keep their job.
It is a
and I'm not 100% sure about that, but I have a very strong feeling. Like I say, there's so much stuff to research about this. There's no way to learn everything all by yourself. In the amount of time that we all need to learn and figure out, what the heck is going on.
Misunderstood field. These folks are, it is one of the most thankless jobs ever.
Oh, yeah.
But they take their job very seriously. And if there were ever a chance that a child was in any kind of danger or harm, it would not happen.
Right.
It would not happen. And I do want to ask very specifically, because there's this...
I feel like they have a very, very different definition of what harm is from what I consider harm. I don't think there's any good reason to do what they're doing.
Idea. I even got a comment just a couple of minutes ago on a video where it was like, well, all of this stuff can be done behind a parent's back. Oh, well, if you're not careful, you could blink and your kid could accidentally fall into a gender-affirming care clinic and come back with less parts or more parts or something like that. Is there ever actually a case where a legal guardian is not in the loop?
Look, there are bad doctors and there's bad medicine practice, across. So I can never sit here and say with 100% certainty I know there's nobody not doing the right thing. But I don't know where they'd be getting that. No.
But in the system of...
But they've changed the laws that if you don't agree with it, they will give legal guardianship to the state. The foster parent is the one that's going to be helping them through all of this. Not the parents. You'll notice he said legal guardian, not mother, not father, not parent. Or even grandparent.
Medicine in the system of medicine because the thing is, anybody could get a sketchy boob job. It's like, well, I can go pay $5,000 for a boob job.
I'll post the law that says where it's happening. Like I said, when did I become the smart one? I thought there was smart people up in the upper areas, doctors, health officials, all these places that are supposedly to protect us. I don't feel like they have the public's interest at at their first interest, best interest, whatever it's called.
At a hospital, or I can go pay Jimmy in his van who says he can do it with $500 with some real great silicone. Those sketchy stuff exists, but like in the system of medicine as it's set up and as it's supposed to work, is there ever a time when a child could go through the proper procedures and then somehow the parents never know? Yeah.
You can't do that behind a parent's back. Like STI screening, yes, like contraception, yes, but like when you're talking about consent for surgery in this scenario,
Yes, you can. Yes, you can. I'll put up the law.
Consent for these hormonal treatments, like, no. I mean, could it be done by a provider that's like going way off the rails? Sure, but that person is way off the rails and is operating far outside of the acceptable standard of care. In the same way other people that are doing like these backyard boob jobs are practicing unethical medicine, and you're doing like, abortions, like, in Philadelphia where you had that surgeon doing things like, not a registered abortion clinic. I mean, there are surgeons that can do bad things all the time. Dr. Death is a great podcast, by the way. So you have like surgeons doing bad things, or you have providers doing bad things, but those are people that lose their licensure. Those are people that go to jail. Those are people that are held.
But I'm having her up against a very respected surgeon at OHSU in Oregon.
Accountable by operating outside of the standards of medicine. And I think like where we are in this field, especially since everyone is so scared,
it looks like to me that those are the people that are being celebrated and pushed about how wonderful this is.
Even though the guidelines have become, I can't say less restrictive, but more individualized. The new guidelines allow for a more individualized approach for this treatment, which makes sense because everyone's journey in gender identity is in fact individualized. But I think a lot of us have become more conservative in practice because a lot of us are very terrified of the repercussions. We really want to try and prevent regret. Regret is, again, very complicated. And so we're trying very hard to like make this a very well done field because so much of this is very serious. I mean, a lot of these are irreversible procedures. They're big deals. And so we treat them as such. So this nature that like people can come in this back door, like that's never going to happen at a center like mine. That's never going to happen at OHSU or Mount Sinai or, maybe in the middle of nowhere at a clinic that like is not registered, and that provider will probably lose their license because it's illegal to do that.
Wait, what? She said that would never happen at OHSU. I'm going to go ahead and sign off now, but I have the evidence before you, my friends. Right there. Okay, I'm going to play a little bit more of this and see if we just get a little bit more, and then I'll just see you on my next video. Oh gosh, yeah, if you have a video, put it in the links, click like, click subscribe, and, just use your voice. Maybe in the middle.
So I want to discuss accessibility for a moment. So the trans community is one of the most disenfranchised communities in the United States, around the world. They are often underemployed. They have limited access to quality health care and are at greater risk for housing, financial, and other insecurities. They are often